like first thing, like the survival mode. You're in survival mode. And
Yes.
to put that onus on the mother to find care for herself, because sometimes when you're in survival mode, you don't actually know what care you want because you know something's wrong. You know that, but we've been not given the voice to, or even just empowerment to be like, yeah, this is not something is wrong. Everything is like, oh, it's just your hormones, or it's just motherhood, or you're just tired, right? And you're just like, wait, but something's actually not quite right there.
Welcome back to another episode of Beyond the Birth Story podcast. If you are joining for the first time today, I'm your host, Alexa C. Girl mom, angel mama to one of the sweetest boys in heaven, birth trauma and uterine rupture survivor, and former NICU mama. Here you will have the opportunity to ask and have your burning questions answered by professionals, feel connected to other women's experiences as we normalize the different aspects of this journey we are on as moms. The real and raw moments of healing are shared here as we navigate loss, embrace strength, and find hope again while learning to live after loss. Please note the topics discussed on this podcast are for educational purposes only. Please see your personalized medical professional if you have any questions or concerns that arise from listening, including diagnosis and treatment. I want to officially welcome you to the Beyond the Birth Story podcast. I'm going to give you the floor right away to brag about all of the hats that you wear, because you wear many, and whatever you want to share, also where you're from. Whenever you're ready, we'll dive right in.
All right. Hi, guys. My name is Sonal Patel. I am a board certified pediatrician. I'm a NICU doc, lactation, and those are my titles. But my story goes a little deeper than that, just like everyone else's story. And where I landed right now is cultivated by the fact that, I was born in India, moved here when I was 9, met my college sweetheart, now husband forever, in at Emory. We moved around the States a lot, which is really nice. And in our move, we accumulated 4 boys, landed in Denver, Colorado. This is where we call home since 2009. And the reason that part is so important, like in everyone else's story, is that it really landed to what I do now. 6 years ago, I opened my own home health company, really on a mission to change what medical postpartum care looks like. And so this is where we're connecting.
I love that. So are you still working in like a hospital setting, or are you strictly doing your new at-home thing?
No, strictly doing the home health business aspect. And also, I specifically did not get a clinic. My clinic is my car. That's my overhead, because it was so easy to fall back to what you're familiar with. And so there were certain decisions that were made, because I did work after I left the hospital. I did work for a year and a half in a clinical pediatric setting. But I realized after a while that was kind of limiting the growth. And it was like, okay, no, keep focused, keep changing, keep pushing, but remove all those comforts that you have that you're very familiar with from the equation. So you're forced to keep on the path.
That is a huge jump, especially when you're so, like you said, the comfortability of just knowing what you're doing somewhere else, and then obviously to take a step back and start something right from scratch. Like, that is amazing.
Oh, thank you. It was a lot of coaching that happened. There was other reasons, and this is why one of the reasons was my own health. And this is why I'm such a big proponent of, particularly after the postpartum, because my postpartum with all my 4 was riddled with diseases and riddled with, and like I've had everything underneath the sun, and I didn't realize that, first of all, my medical system was not able to effectively address all of these. Then my society wasn't, meaning the society I live in, did not recognize how much healing that mother has to go through. And then my health just hit me. And when I reflect back, it was everything that happened to me in postpartum. The lack of care, the lack of everything that happened. And so it was kind of pushed on me to change, because I knew that I couldn't keep going with the stress of being in the hospital. We were raising 4 boys now. My husband's also a physician, and something was breaking, and it was my health that broke. And it was just
Yeah.
like, oh, okay, that kind of sucked,
Yeah.
to have that monumental thing that you take for granted all the time.
Mhm. It's crazy how our bodies are such good teachers, right? Like we may not on a conscious level realize how stressed we are until our bodies quite literally shutting down or we're getting so sick or having like these health issues. And it's like, okay, like hard stop. What needs to be done? Like that is something that I've really learned in the last 3 years. And, just getting in tune with that and being like, okay, what is my body telling me? And the fact I am such a believer that, these things happen in our lives. And I'm not saying everybody's obligated to change the world with what happens. If you want to be silent, be silent. However, when you take an experience such as your postpartum, and how that all played out, myself with this space, it like you do so much good with it because you're passionate, you've been through it,
Yeah.
and it's so powerful to be like, absolutely not. Like we are going to take the responsibility of making change and making sure that other moms and their families and babies don't have to experience the same as us. And that standard of care needs to be raised. Like you're so right, in the postpartum period you get, unless you're finding your own resources. In
Yes.
Canada here, we only get the 6-week checkup.
Yeah. Yep.
And it's a hard focus on like, are you sad? I don't know. Like I have all the face hormones. And do you want birth control? Like those are the things
Yes.
that stick out. I'm like,
Yes.
fuck no, I don't want birth control. Pardon my French. But like, and
No.
don't just ask me if I'm sad. Of course I'm sad. Like
Yes.
and
No.
then what are you going to do with that information? They're like, okay, that's normal. See ya.
Yes. I mean, you've hit on so many items. Like, first thing, like the survival mode. You're in survival mode. And
Yes.
to put that onus on the mother to find care for herself, because sometimes when you're in survival mode, you don't actually know what care you want because you know something's wrong.
Mm-hmm.
You know that, but we've been not given the voice to, or even just empowerment to be like, yeah, this is not something is wrong. Everything is like, oh, it's just your hormones, or
Mm-hmm.
it's just motherhood, or you're just tired, right? And you're just like, wait, but something's actually not quite right there.
Mm-hmm.
And I hate the 6-week appointment. I mean, I don't know the stats in Canada, but I know here in the United States, 40% of women do not go to that appointment for 6 weeks because it's viewed as, okay, do you have the mood to have sex?
Yeah, literally.
You're like, my headspace is, I don't even want, like, things are still leaking from everywhere. I don't want anyone
No,
touching me.
you're swollen. You're like, "Ugh."
Yes,
That's so true.
exactly, exactly. So,
What does, like, let's dive into normal versus abnormal. I don't even like to use the word normal, but you know what I mean.
yeah,
In that postpartum period, because often first time moms, like you literally have no clue. And then for subsequent pregnancies, it's like, yeah, this may not be my first time postpartum, but it is my first time postpartum with this baby and with this experience. And
yes,
I can promise you they will never be the same. And I'm sure
yes.
you can attest to that. So
Oh,
let's deep dive into that.
okay. Well, I have a quick question for you.
Yeah.
So, when I say the word postpartum,
Mm-hmm.
like just when you hear that word, what imagery does that resonate with you?
I just picture, again, like that very early stage of like, you're still bleeding, you're, learning how to feed your baby, you're swollen, you're sore. And then in my head, in my experience, I'm like looking forward to that 6 weeks because in my head, it's going to be a click and I'm going to be good.
Yeah,
And
yeah.
it's not.
It's not. And I think some of the words that you say, like bleeding and soreness, it's like heavy kind of words that are describing.
Yes. Yeah.
Now, what if I said that you're in your fourth trimester? What just changing that narrative?
Mm-hmm.
Does that give you, like, yeah, what does that mean to you?
I feel like because I've heard it more often now, it's like opening up a longer timeline for healing. However, I'm still stuck in the postpartum
Yes,
word, but that's all we've really talked about, right?
exactly. Exactly. So that's the first thing that I like to change is the narrative around it, because every if your body has gone through pregnancy, your body has to go through the fourth trimester.
Mm-hmm.
And even these are, since I'm a NICU, we do NICU home visits too. So even if the baby is not full term, that mother's body still is going through a fourth trimester. So that baby could be 30 weeks, just the right at the edge of the third trimester, but that woman's body is going through the fourth trimester. And when we change that, we open the dialogue up, like you just said, healing. There's a progression of healing that is occurring. And then from my lens, it's we take that healing and add the science behind it to, stop saying it's all hormonal
Mm.
and really adding the science behind it, because I think even with any disease process or anything with the symptoms, once you're given a label for it, it's easy to figure out how to take the advice, take the outcomes, take the
Mm-hmm.
treatment, and you're able to decide for yourself what works or what doesn't. So I say everyone goes through the fourth trimester. It's postpartum that's where we're trying to prevent. So what does that mean? Is we're trying to prevent that excess heavy bleeding that might make you concerned about, is this normal or not? We're
Mm-hmm.
trying to avoid the postpartum depression. We're trying to avoid breastfeeding challenges. All these things that are feel so heavy, and continued the narrative of, motherhood is just hard.
Mm-hmm.
And allowing that shift and change. So let me just quickly add a science thing behind you. Um, we talk about progesterone a lot, right? Progesterone is to help once you get pregnant. It is predominantly, most of it is coming from the placenta. And over the 9 months, I say 10 months because I was like, who said 9 months? It's 4. During that time period, it rises from baseline to about 8 times the level. It makes sense, right? As the placenta grows, the baby grows, you are trying to maintain that hormonal level, that it grows 8 times. So at 40 weeks, it's 8 times the baseline. When do you think it comes back to baseline?
Oh God. I think of it as a hormone crash. So as soon as that placenta is delivered, boom, down.
Exactly.
Okay, I'm right.
Exactly. Yes, you're right. You're absolutely right. But could you imagine that? Like, I mean, like
Yeah.
literally scientifically think about that you have something in your body that took you 10 months, 40 weeks to develop. And all of a sudden, the minute the placenta comes out, your body goes into this whoosh, crash.
That made my whole body like goosebumps.
Right. But this is what led the research into it. This what led that progesterone might have a role in postpartum depression. This is what led to all those studies and advocating now that the FDA here in the United States a couple of years ago approved an analog of progesterone to say that, hey, there's some women that the crash is just with anything that happens in your body. Some women are at higher risk for having those effects, and some women take it fine. That's with
Hmm.
anything that
Yeah.
happens in your body, right? Any medicine you take, any insulin levels, anything. Some women are just predisposed to it. But this is why it's just so important to relabel it as a fourth trimester, because then you're like, oh, I have 3 months. And technically it's more than that, but like everybody knows, the society knows, everybody knows that you have 3 months to actually like really focus on your healing.
Hmm. I want to circle back to what you said about like NICU visits and prematurity. Our son was born, our youngest son was born at 28 weeks and 5 days. And we came home the day he turned 35 weeks. We were in there for 46 days or something like that. 6 weeks anyway. And I remember thinking, like, okay, when we go home, like, I'm just going to be, again, normal in quotations. I'm going to be back to normal because, well, I've hit my 6 week period. Um, Little did I know that once I got home, like, I'm still just taking my baby home for the first time. Granted, he was still 5 weeks premature at that point. We're just learning how to breastfeed because I was exclusively pumping, trying to figure out a preemie, not sleeping. And it brought me right back to what it would have been like to, deliver a full term baby and go home 2 days later, fresh postpartum. And that like shocked me. I'm like, why is this so hard? I've already been healing for 6 weeks. And yeah, not the case at all. It was all very new and very fresh nonetheless.
It really is, and I think the NICU stress of it is because, like anything, your baby should not be going to the NICU, right? We're there for you if you need us, but no one in their birth plan says, "Oh yeah, I'm going to go to the NICU." And we see that across moms, even moms whose babies have been then only in there, like only because from my point of view, 6 hours versus 6 weeks,
Mm-hmm.
because it's so jolting to the system, and there's so much guilt. And initially in the NICU, when you are in the NICU, you're just in like this mode as a parent of, I just want everything done for my baby. I want everything, whatever the doctors will say. And my cortisol levels are super high because I'm just in super survival mode.
Mm-hmm.
Now the NICUs are changing that. And again, I'll speak to more of where I live, but those NICUs are getting a psychologist in because we didn't do a really good job of addressing what the parents are going through.
Mm-hmm.
And the psychologist, I think the validity of it is where you start with that. Yes, this is an experience. You might be challenged not only with yourself, but also your relationship, because you're trying to balance going back and forth, and then you're put into this world where you've gotten care for your child for 24/7. They have been nurses there all
Mm-hmm.
the time. No one sometimes eases you out of that care or eases you out of that. And it's just a stark reality to be like, oh, boom, now go home. Wait, where are the alarms going off? Where's the nurses? Where's everything plugged in? And it is such, again, like that progesterone, it's a crash,
Mm-hmm.
right? So here in Denver, we have a partnership with Children's Hospital here in Denver to do NICU transition visits, where either myself or a nurse practitioner will go after they've left the NICU to have that one visit after the 24 hours, just to kind of see, like, okay, now you're in your home, now you're in your setting. They
Mm-hmm.
continue to have their own pediatricians. They will go into the outside, quote unquote, the outside world of medical care, but we're really realizing that there needs to be a bridge between the
Mm-hmm.
inpatient and outpatient world.
I
So,
love the idea of having a psychologist right in the NICU.
mhm,
That is incredible.
yeah.
Because, like, for me, when I was there, I was just connecting with like other NICU moms and we were comparing stories and things like that. However, and I think too, like, I've been out of the NICU, well, since July 21st, however long that is.
Mhm.
Um, and I still don't think I've started processing the NICU. I'm like, did that actually happen? Like, did I go through this? It feels so fake. And I don't, yeah, I'm also processing a lot of other things, but it literally still doesn't feel like a part of my story. And when I was there, I don't even think I processed that we were there. I was just like, you're going through the motions. You're literally on autopilot because all of a sudden you have this NICU baby. And you're like, well, this isn't the plan. It's too early. You're panicking and, you're just trying to get used again to all these monitors and the attachments. And if your baby's intubated and if they're, like watching case get a pick line and everything like it. And I'm a nurse. I've seen it. I've like been alongside it and nothing could have prepared me for that to be my 28-week-old baby.
I think one of the biggest things is for NICU families also is like that, just like, can I touch my baby? Like that coreness of like, can I even
Yeah.
hold their hand, or can I touch their skin, or will an alarm go on if I just touched my baby?
Mm.
It's
It's
there's
hard to like want be
it's
their parent in there, right? And not wanting to step on the toes of their providers or
yes,
nurses, right? It's
yeah,
like, well, what am I allowed to do?
yes. And I think one part of the NICU too is like when you have a group of moms and stuff, you start justifying your own story, like, oh, my baby's not sick as X, Y, and Z, or my baby is doing so much better, or my baby got to come home, or my baby didn't have this. Like you fill in that blanks to justify that your story and your experience was not as bad,
Mm-hmm.
right? Versus like, no, 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 let's really kind of talk about what happened and give you the space to process it.
Mm-hmm.
You say that. I wrote a book, The Doctor in Her Black Bag, and it's reflecting. And in that book, I had talked about all my pregnancies and my postpartum. My son at that time, my oldest, was 16, 17, and I had a C section delivery. It was a failure to progress.
Mm-hmm.
And we lived in New Orleans at the time. In our apartment building, we lived on the top, but didn't have an elevator. So 4 days after I come home and I'm going up and down these stairs, and then, he needs pediatric care. And so I'm going up and down these stairs. I had pelvic pain for the longest time. Everything was kind of falling apart. But until I wrote it, 17 years later, is like my husband woke up and I used to write early in the mornings, I just started crying. And I didn't realize how much I was holding that in.
Yeah.
And I was just like, what just happened? And he's like, and my son's 17, he's healthy, he's good,
Mm-hmm.
everything, life continued. But I just didn't realize I was holding that
Mm-hmm.
so dearly to me for 17 years. So I think as a medical community, we need to do better in like allowing the psychologist. What we do in our home visits, the first thing I ask is people's birth, because I don't think there's space right now
Yeah.
when you have a quote unquote normal and you go in there, there's no space to ask for birth. So if any physician, any provider is listening to this, a study has been done that even if you are in a clinical setting and you ask about a woman's birth, it only, so everyone's like strapped for time, right? Like everybody's like, oh, we're not enough.
Mm-hmm.
But the studies have shown that it only takes that woman, it takes 2 minutes maximum for them to tell your birth story, for them to tell you their birth story. But in those 2 minutes, you as a provider, as a physician, someone who's taking care, as a midwife, whoever that person is, that just acknowledgement of birth increases the rapport and the trust with that provider tenfold, because you've taken 2 seconds and 2 minutes.
Mm-hmm.
That's the average, right? I mean, obviously, some people will talk more, but you've opened the door to really recognize
Mm-hmm.
that person who has just given birth.
That's amazing. And I love what you said about life continues. It's like no matter what kind of birth you have, what those early postpartum days look like, granted your baby is home with you, you still just have to keep going and take care of them the same way that you like they need you the same way.
Yeah.
They need all of you all the time. And where's the time for mom to process what happened to her? And then you go on to have more babies, and life is busy when you have children. Like you said, 17 years later. And I think that's a testament to, this is called beyond the birth story,
Yeah.
how long that really is. It's forever that you will hold on to that and you'll think about it. And it may not hit you like it did when you were writing, but it's always going to affect that a large piece of you.
Oh, definitely. Definitely.
Oof. Life continues.
Life continues.
Sure does. um, I'm gonna circle back to the beginning now, and you said um, preventing postpartum depression. Talk to me about it.
Yes. So I had postpartum depression. I
Mm-hmm.
had also postpartum anxiety. So one
Me too.
second, yes. And again, I didn't know these terms, right? I
Yeah.
mean, postpartum depression, but I didn't realize there's something as postpartum anxiety. So my
Mm-hmm.
postpartum depression was my second, postpartum anxiety with my third. I didn't know these, like that could happen, or, other things about. So regardless. Okay. So how do you prevent it? Well, this is the whole point of changing what medical postpartum care looks like. And I emphasize medical. There is definitely a lot of home visitation hats that people wear, like nurses come for home visitations. You might have a postpartum doula. You might have, fill in the blank. In the States, we have this called parent as teachers. So you have other versions of home visitations into the house. But why is it medical is just so imperative, and one of the most building blocks that's not there is because when you bring that medical piece home, first of all, someone's allowing you to come to their home. There's that trust already built in from their end. Second is you get to provide care in a place where they feel safe so
Mm-hmm.
they open up to you even more. And then the medical pieces that we can not only diagnose, but we can prescribe and we can treat in a very timely fashion. So postpartum is very timely. Like I don't think people understand that. That yes, you have the first 2 weeks, we say, oh, you have the postpartum blues and all of that stuff. But now we're even realizing this perimental goes from sometimes even before you start conceiving. If you haven't addressed the mental health and any of these issues that you're facing, and it comes out in postpartum, it just does. So when you know that postpartum and you treat it like any disease, that there's a time things for it,
Mm-hmm.
then you can prevent all of it. So I like to give examples. So I had this mom, and we did our first home visit. So we usually do it right after the hospital. They get discharged from the hospital. 24 hours after that, we're doing our home visits. So just specifically talking about postpartum depression. That mom, we did the home visits. Our visits are about 60 to 75 minutes long in their homes. And I get a phone call 2 days later. So this mom, now she's 7 days out from delivering. And she goes, I don't want to be a mom anymore. I go, oh, okay. Did you reach out to your OB? I did, but they're going to get back to me in about 4 to 5 hours. Okay. But I do have a psychology appointment next week. Okay. Now, this is what people don't understand, why this medical piece is important. That mom has clearly told me, I don't want to be a mom
Mm-hmm.
that day. We've talked about progesterones, and then there's other hormones that we can talk about, but that is so timely. Like she
Mm-hmm.
can't wait a week later to get help. Like that is not timely. That's basically someone coming into the ER and saying, I'm dying. And you're like, oh, wait a minute. Don't worry about it. We'll do the
We'll treat you
treatment
next week.
next week. Right? And so for that particular case, my in my team, I do have a therapist, and she got on the phone with her, created a plan. We got the family involved as well, and she went and stayed with her family, and it was all hands on deck. You know, her family wasn't even realizing it because everything is supposed to be so blissful and so beautiful, and the Hallmark and the Hollywood
Mm-hmm.
movie aspect of it. And she's doing fine now. She's doing great. But that's what postpartum depression is. That is why when the news comes out and says, oh, there's the highlighted news in Massachusetts about a couple of years ago that a nurse, and you're like, well, she should know better because she's a nurse, right? But she dealt with postpartum psychosis
Mm-hmm.
like 7 to 8 months after the fact.
Wow.
And what happens is that we just blame the moms. It's like, oh, the moms didn't get care, versus let's be critical of how we failed as a medical system and how we failed as a society, that we allowed that mom to get to that point.
Mm-hmm. That's a hard thing for people to do, especially in the medical field, I feel like, is that accountability piece. It's like they don't want to be responsible for that,
But we,
right?
but we do, like in the NICU, we have these maternal mortality or morbidity conferences are called M&Ms, where we go through cases. So we should be really treating postpartum in that same respect
Mm-hmm.
and really looking at it from an M&M. So yes, you're absolutely right. The accountability, the thing, but once they're out of the system, they're out of mind, out of, oh, they should come to us. Why we shouldn't be providing there. And it's just mind boggling. So
Yeah.
in my 6 years that I've been doing this, we have now approaching about 390 dyads. So we also term the care differently. So dyad care means that the mom and the baby we need to still see as a unit
Mm-hmm.
despite physical separation, because there's so much is happening in the mom that's influencing the baby and vice
Yeah.
versa,
Mm-hmm.
And so, and that's medically speaking, right? I mean, jaundice and breastfeeding, they just kind of go hand in hand.
Yeah.
So of those moms, 390, 20% come on some sort of SSRIs or some sort of, medications for their mental health.
Mm-hmm.
There's only one mom I have told that, hey, listen, I think you need, and she was on anything, but I think you need a postpartum depression medication. Like this is really a lot.
Mm-hmm.
So the majority of them, you're like, well, what about the majority of them? They just need the space to validate their healing. They need the space to, when we usually do a appointment around the 4 to 6 weeks, because that's on top of the home visits. That's a virtual appointment we do with our moms, because we want to give them the space to be like, this sucks. Like, could you help me?
Mm-hmm.
This is sucky. And you're like, yes, this sucks.
Yeah.
Welcome. You know,
Preach it.
sucks. It sucks. But to give them the validation in this space, to
Mm-hmm.
come to someone who's a professional and just say, this kind of sucks. And you're like, yeah.
Yeah,
And it
it
helps that I
sure
have four
does.
boys.
Yeah.
It just helps that they know that, like, yeah, I'm not going to, and I've built the rapport with them. So
Yeah. I was gonna say, how special is that this mom felt comfortable enough to pick up that phone, call you, and tell you how she was feeling?
oh
Like,
yeah.
I think that is amazing. And you said too about like um difficulties trying to conceive and all of that, how it comes out in postpartum. I think that's very powerful because like for myself, pregnancy after loss, and then having my baby here, I have tons and tons of friends who've dealt with infertility, whether or not it took them a long time, they ended up naturally conceiving or in vitro.
Mhm.
It's one of those things that now, and I'm speaking from like personal, is well, now that this baby is here, I cannot complain about, and yeah, complain. I'm going to use that word because
Yes.
that's what we do. That you don't have the right to do that.
Yes.
And you do. Like, just because you went through what you went through to get this baby here, it's not all sunshines and rainbows. Like, and it's okay to say that.
Yeah.
It's okay. You don't have to love it, just like you don't have to love every minute of pregnancy.
Yeah.
Like if I could just have the baby, I would. That would be perfect.
Yeah.
I didn't have to go through the 10 months. Like,
And I was the opposite. I'd rather be pregnant than go through postpartum because I had such a difficult time. Like
yeah.
I always said, I made a great postpartum. I made that Instagram, Hollywood, like picturesque postpartum woman, like
Yeah.
pregnant from the front, looking good from the back, let's just say, like all of it. But good God, postpartum killed me, like literally, physically, emotionally, mentally.
Yeah.
And that's what I tap into. And you're absolutely right. It's such a privilege and an honor to have women just allow themselves to be that vulnerable with me,
Mm-hmm.
and knowing that they're not going to be judged, knowing that,
Yeah.
that whatever they're feeling at that moment, it's fine. It's
Mm-hmm.
totally fine. And again, we use, like you just said, complain, right? We add those words
Mm-hmm.
versus we're just reeling with this. Like,
Yeah.
we're not
Like, let's
complaining.
just talk about it. It's okay. And I feel like there's like a piece of shame like that too. If I'm complaining, like, yeah, it's my baby, you know?
Yeah.
And I'm just going to take this opportunity too, because you said what an honor it is for people and moms to trust you. And I just think of all of the moms with like lived experience who literally put themselves out to the world on this platform. They log in that day and they get real, they get vulnerable. What an honor it is to be the one to hold space with them. And
Mhm.
like, just as it's not easy to do this, it is not easy to call up your provider and be like you said, I don't want to be a mom anymore.
Yeah.
And like your doctor probably like, oh, you know, that'll pass. That's just part of postpartum. But to have someone that can tap into the deeper parts of that, there is like that. I think that's one of the most important pieces of it all.
Yeah. Because it's a lot, they're saying a lot, right? And I've been in the home, so you pick up a lot. Like we're just detectives, we're just really
Yep.
trained detectives, and sometimes our systems don't allow us to just give us the opportunities to do that. And I think that was one thing too. I was like, I'm just tired of it. I'm tired of
Yeah.
trying, even in the NICU initially. I mean, I would talk to my families a lot, and then at the end of my NICU time when I was there, I was just becoming a admin paper pusher, and I was like, I
Mhm.
don't. This is not why I went to med school. This is not why I
Yeah.
sacrificed all I did. I want to have those opportunities to really not be on a time
Yeah.
and just kind of talk.
I
So
love that. I
yeah,
want to talk about baby blues
yeah.
versus or comparison to the postpartum depression and or postpartum anxiety.
Yes. So if going back to, and I think this is so important when I talk about these things, is I love adding the science behind it, because women
Yes.
are super smart, and then they realize, like, we always talk about hormones, right? Like hormones in our body.
Throw it around like it's just it's normal. They were like, goddamn hormones.
Right. But if I can explain to you that this what is happening in your body, then you're more likely to be like, oh, this is happening to me, but not, you know what I'm saying? That verbiage everybody uses.
Yes, it's
You
happening
know?
to you. It's nothing that you're doing. As women and moms, we automatically assume, well, what
Yeah.
am I doing wrong?
Yes. And so when we say postpartum blues and we say the numbers are 70 to 80% of women go through it, but now you understand that placenta that has
Hmm.
built that progesterone up for what, 10 months, all of a sudden that gets taken away. And then here's the key, not only explaining to moms, but also explaining to the dads, because the dads will look over and be like, oh my God, that's what happens in your body. Right. And then the moms will be like, yeah, this is why I'm like, and it's just this light bulb that goes off.
Hmm. Men don't know a freaking thing about this. Like
Mm-mm.
I talked about postpartum rage with my husband a while back. He goes, "Oh God, what more terms are they going to come up with?" I was
Yes.
like, "Fuck you." I'm like, it's true, but they're so clueless. They're
Yes.
like, we don't get it. Like the house should be clean, the kids should be fed, you should be showered. Like,
Yes.
yeah, I'm barely surviving.
Yes. I'm barely, like, things are leaking. Like things are leaking in orifices that I didn't even know that we had orifices to exist. Like things are
Right? I'm like, I'm wearing a diaper, the baby's wearing a diaper. I remember my husband saying when we were in the NICU this time, he was like, "Oh, you recovered so well this time. Next time will just be a breeze." I'm like, I had no choice but to walk up to the next floor to go see my baby. And 3, 4 weeks later, my incision burst open. Like, I don't think I handled it well. I was given no choice. If I wanted to see my baby, my feet had to move.
yeah. Yes. Exactly.
Like, thanks
Exactly.
for the compliment, babe, but no thanks.
Yes. So going back to postpartum blues, right? Like now, if
Hmm.
you explain the science and say this is what's happening in this body, because at that time too, the dads are kind of just reeling also, and then they look over and they're like, "Oh wow!" So
Hmm.
you actually add scientific explanation to that. So that's one. I might actually digress just a little on that. So the postpartum blues part. So I'm a huge proponent of maternal sleep and naps. That is key. And so when I tell them that, because we know sleep is protective of postpartum depression, we know that. But we have to tell them when and where and how to sleep. Now, I've just told you that your progesterone goes down. The other hormone that is huge, and this is not, even if you're not nursing, is prolactin, is a hormone that makes the milk.
Mm-hmm.
And you can actually see this in non-lactating people as well. That prolactin actually has a circadian rhythm. So what that means is that it's really high at night. It peaks in the morning, so around 3, 4, 5 o'clock in the morning, and then it starts slowly dipping back down into the afternoons. So when you talk to women about it, they're like, "Oh yeah, I had a really bad night of cluster feeding, but they in the mornings they're still kind of wide awake, and they're like, well, I know I had a bad night, but I'm feeling okay." And then in the afternoon, it hits them, right? And when that hits them, what's happening is your prolactin levels are going down.
Mm-hmm.
And when your prolactin levels go down, that's also dictating your circadian rhythm of sleep. So in the first 2 weeks, we cultivate, this is, and so again, dads are very objective. So give them something to do, right? So
Yeah.
you have to protect her sleep in the afternoon. So
Mm-hmm.
let her feed the baby if she's nursing, and then she goes away. You're in charge of the baby, you're in charge of everything else. She'll go away, and this is not a glorious nap that you can sleep forever and ever, but it's usually about an hour and a half. And why does the mom need to actually separate herself from the baby for that time? Is because any mom knows, the minute that baby makes a noise and they're sound asleep, your body goes, "Oh my God, I need to do this. I need, where's my baby?" So you're removing that. You're giving the dad something to do, hour and a half, and they come back refreshed. What I see a lot is that they try to divide the nighttime, but the nighttime is not the right time to divide it in the
Mm-hmm.
first 2 weeks because of your prolactin. Because you have to get up anyways, because your boobs are going to be really huge. You're going to start leaking because you haven't pumped or you haven't breastfed,
Yes.
right? So in the first 2 weeks with postpartum blues and stuff, if we can really objectively start protecting the woman's sleep in the afternoon, then we can prevent postpartum depression. Now, postpartum depression, there's actually a bimodal time period. So if you are not given the ability, the validity of your birth story, the ability to heal from, like you said, a C-section, I truly believe, physical pain leads to mental anguish. And that was
Oh, yeah.
my second one. And that's why I got depression. It wasn't because I just wasn't allowed to heal
Mm-hmm.
from what I went through. And so if we can do that, we can prevent postpartum depression. But then the risk increases for postpartum depression, and postpartum depression usually comes around 4 to 6 weeks. And sleep, again, we go back to sleep. And one of the sleeps is not getting too little sleep, which is really intuitive to understand, but also getting too much sleep. And you're like, wait, how does that happen? Is that every single time you have, like, you do your work, you sleep, you do your work, you sleep, you do your work, you sleep. That's also a red flag. And the other third red flag is that if I give you the ability to sleep, like I'm like, okay, I'm protecting this nap for you, no electronics or anything like that, you can't just shut down.
Mm-hmm.
So sleep is such a huge component and protector of postpartum depression, but we don't know how to do it properly because no one's explained the prolactin circadian rhythm. No one's explained this is progesterone kind of coming down. And then you give them the source and it's like, okay, now you figure it out what how you can make sure that her sleep is there. Now, postpartum depression, 4 to 6 weeks, we can talk about all those risk factors. But the other time it comes up is around 6 to 9 months. So someone could have gone through the postpartum, someone could have been great, but there might be something that triggers this postpartum depression. And sometimes the most common reason is going back to work or having something drastically change, like going back to work.
Mm-hmm. I still feel that way now. Like at 3 p.m. every day, it's like a wall that I hit. I'm like, oh my Lord.
Yeah.
And I'm not a coffee drinker, so I don't even have that in my corner. But, and then I solo parent all week because my husband works away. And so even the other day, like I went and had a nap with our son because he's a contact sleeper,
Mm-hmm.
God forbid. And I've noticed too, and you can kind of explain this to me. Um, I'm going to admit it. He does co-sleep right now because that's the only way he will.
It's okay. How old's your son?
He'll be 11 months next week,
Okay,
but
are you still
eight
nursing?
corrected.
Are you still
Yes.
nursing?
Oh,
You're
yeah.
still breastfeeding? So let's not undermine all that science. And we don't have time for that, but there's a lot of science. And that's like the fun part about my job now that I keep discovering and really coming to you guys and saying, okay, like let's chill just a little. We all want safe sleep. We all do. But let's just chill a little and give you the education that breastfeeding is also protective. And if
Mm-hmm.
you're continuing to directly breastfeed too, that's so protective for SIDS. So continue.
I love that. But I notice that at night he gets up consistently. And even if I'm away, he's totally content. Like if I step out of the house and someone's watching them, the moment my presence is in a room, I won't speak, he won't even see me. It's immediately like, boob. He's like, I can
Mhm.
smell it. I'm like, is that why you're getting up every 2 hours? Is because it's right there and you can smell it and you're like, I need it. And not even that you're hungry. Because he won't take a soother. I am his soother.
Mhm.
And he's like, and then if I pull it out of his mouth, he's like,
It's
where'd
like,
you go?
how dare
Freak
you?
out, freak out.
How dare you do that to me?
How do I navigate this? Like,
So you already have hit on everything that he's doing to you. Now you have to be, this is the hardest part. Now you actually have to be a parent. Yes, I know. I'm like, "Arr!" And you
yeah,
realize what's happening and you have to be a parent.
yeah.
And sometimes, and so here's the really good key thing. If you look at it as you are teaching them skill for sleep, you are teaching them the skill to sleep. That is more powerful than I'm sleep training because I hate training because I
Mm-hmm.
don't think you can train a human. I just don't. You can never train a human. But if you look at it from the point of view that if I teach my baby now how to have good sleep habits, we know all this wellness data that comes across with adults. We know all the disease. It always leads back to the higher risk factor is the poor sleepers. That's it. So now we change our mind and say, okay, now I have to teach my son how to sleep. It's like teaching them how to ride a bike. You
Mm-hmm.
research it and say, okay, listen, the strider has a good balance because developmentally, so you got to add the developmental part of it. Developmentally, that's good for balance because they don't have the strength to actually pedal. And then when they have, so you can use the strider starting at like a year or a year and a half even. And then when they're 3, when they actually have that strength to pedal, biking becomes like that because
Mm-hmm.
the balance is already there. So sleep again, if you look at it as teaching them as a skill, so an 8-month-old, yeah, they're capable of sleeping at night. Is that mommy's there and they are relying on a habit that why wouldn't you? Like as any
Mm-hmm.
human, I think we forget babies are humans too. Like, good God, like someone gives me food and I can go back to sleep.
Yeah, seriously, I don't even have to get up. I just
Oh,
roll over with my
yeah.
head. Oh my gosh. Literally the other night I wore braids to bed and then I like roll over and he'll spoon me. He was grabbing onto my braid and tugging it until I rolled over to give him what he wanted. Man.
Yeah, and any skill, it takes time to
Yeah.
get adjusted to it, right? It's like if I told you you have to go work out and I make you work out like 4 hours, you're not going to come back to it.
No.
So you have to make a plan. You have to get your resources. You're like, okay, and continue to say, okay, this is a skill I'm teaching for life. Then you can stick with the plan. I think that's the
Mhm.
hardest part about parenting is like you don't know what the plan is. You guys research 10 times over. Everyone has an opinion,
Mhm.
but you forget what would work for you and not versus like, okay, developmentally, it's an 8-month-old baby. This is a skill I'm going to teach him. I'm going to kind of lean into the fact that what are the resources I have in hand? What is my lifestyle? Like you said, your husband is away or your partner is away. Well, Okay, do I have enough resources to ask my family and friends to come over? Do I have enough resources to kind of get a temporary night nanny or a sleep special? Like, you look at those paths and you come up with a plan, and then realizing it does take 2 weeks
Mm-hmm.
once you execute the plan. And the hardest part is being the consistent parent to stick with the plan.
Yeah, and 2 weeks can feel like forever when you're doing
Oh, yeah.
something like that.
Yeah. Yes.
Oy.
Yes.
I have my work cut out for me being a teacher of life.
Oh.
And every baby's so different. Like my daughter, her own room, her own crib from pretty much the day we brought her home.
Mhm.
So I just assume that's what babies do.
No,
Like
no.
I blame the NICU.
The thing is that I think we forget every baby's a human. So every
Mhm.
human is different also. This last one, I did a little thing on crying, and you can see the difference. Like, there's a chart of baby crying,
Mhm.
and some babies where they cry really a lot and some babies cry very minimal. And I like joke, the ones that cry a lot are like usually those men who have the man cold. See that?
True. Oh, I got one of those in my house. And it's so funny because like we were just talking with my father-in-law the other day, and he said, "Yeah, we took Paul on a plane when he was younger, and he screamed the entire time." He's like, "We haven't been on an aircraft since." And now when he gets man cold, he starts warning you 48 hours before. You're like, "Oh my god,
So I
please
was
go
right.
back
I
to
was right
work."
in theory.
Oh yeah, your theory is right. Oh my gosh, that's so funny.
Yeah.
Yeah, what a crybaby. They
Yeah.
never grow out of it.
They don't, because they actually have not been taught how to grow out of it either. Like, think about it that
True.
way.
Mhm.
Like, their needs have been met. Like, so for your father-in-law, he's like, well, we just stopped flying, as opposed to let's teach him how to
Yeah.
cope in a flight. Right? That was the thing. It's like, oh, we're just gonna stop flying forever until he's
Mhm.
older.
Yeah, so true.
You know?
All right, well, I'll teach him for 2 weeks and not to be a baby, and well, we'll teaching my son how to sleep on his own.
Come up with a plan, though. A
Right.
plan that fits your lifestyle. And come up with a plan and come up with resources that
Hmm.
you can tap into. And again, going back to postpartum, going back to this, we don't have to do it all alone, but we forget to ask how to ask for help.
Yes. Yeah, that's a whole nother topic of like
Yeah.
figuring out that part of it, right?
Yeah.
I have one last question for you, and it is, as someone in like a position as yourself in the NICU, what would be one of your biggest pieces of advice for a parent actively going through the NICU?
Oh, that's wonderful. Um, One of the biggest advice that I would give is, if you're able to get, and your NICU does not have a counselor,
Hmm.
or they don't have that, and your insurance can cover a psychologist, it's okay. It's okay to start processing right away. Like, why are we treading through this alone? And definitely there's wonderful resources out there like March of Dimes, group settings and everything like that. It's a trauma. So just like with any trauma that will happen, what we think about is our physical trauma a lot. When we have a physical trauma, we go to who? A therapist. What type of therapist? A physical
Hmm.
therapist, to help us recover. We don't wait, right? We're not like, oh, you know what? I twisted my ankle and now it's been 3 weeks. We're so proactive about it because we've been taught to be proactive about it.
Hmm.
So, just in that same sense, that this is a trauma that's happened to you, and let's just kind of address it. And now we need a therapist, and now it's a mental therapist to help us guide us through this, so we're not holding on to our PTSD.
That is so powerful. I, f- yeah, I feel like we're getting better,
Yeah.
but there is this stigma about therapy.
Yeah.
And people are like, then I have to open the door for healing. And that's a scary thing.
Hmm.
And for me, I've been doing therapy for 3 years and I'm still like, what's going to come up in the session? Like, I'm terrified. However, I always leave feeling better. And you've said so many times today about time being so critical.
Mhm.
And to, I can only imagine that during my NICU stay, I would have been in such a different place. And I did do a couple sessions of therapy. I did not deep dive into the NICU experience as much
Mhm.
as opposed to delivering after stillbirth. And so to have someone, and I'm sure if I would have started talking about it, we would have unpacked it. I almost wish I would have done that a little bit more. But again, in those moments, I was strictly surviving.
Mhm.
That is it.
Yeah.
And now, yeah, like I said, I'm sitting here still waiting to really start unpacking that.
Yeah. We're launching our postpartum coaching or getting prepared for the fourth
Mhm.
trimester, and one of it is really like, what kind of parent are you? So to look internally and to be like, okay, what kind of parent do you envision yourself to
Mm.
be?
Hmm.
That is just, it illuminates a lot to be like, okay, what would you do in this kind of situation? What would you do in this situation? And they're very like comfortable questions, right?
Yeah.
But it kind of gets you thinking that, oh, I'm going to be a parent. And one of the things like I highly recommend for this new generations that's coming up is, I'm glad that the new generation is more leaning in towards the mental health aspect of
Hmm.
it, because it's okay. It's okay to like, why not walk with help? Why
Yeah.
not walk with all of this so you can actually live a fulfilled life that you can cultivate? So it's starting off with, even if families are going through the whole process of conceiving and everything, just to have a session, a family therapy session. It doesn't have to be unpacking a lot. It doesn't.
Yeah.
It just means that, hey, what are you going to do in this situation? Like, oh, you know what? Like, so for example, like when I mean it's not that benign, me and my husband know that I cannot handle throwing up. I start vomiting with my children. Like it's this reaction. But he can't handle diarrhea. And I'm
Hmm.
fine with that. Like, and so we just know that about each other. So if
Yeah.
some kid is throwing up, my husband goes in. If some kid is having diarrhea, I go
I
in.
go in.
But like I'm saying, it's not this deep.
Yeah.
It doesn't always have to be deep. It just has to be like, okay, what can you handle? What can you not handle?
Yeah.
Can you handle blood? Can you not handle blood? How do you handle if you see, you're like, my brother, my brother cannot handle, though he's a physician, but he cannot handle when his one of his kids gets sick for
Hmm.
long periods of time.
Yeah.
He the when you talk to him, like the for his kids, it's like the Chicken Little, like the sky is falling. And then you talk to my sister-in-law and she's like, oh, it's fine. But those are the kind of stuff. It doesn't always have to be like childhood trauma or parental
Hmm.
trauma, nothing like that. It's as simple as, can you handle the vomiting or can you handle the diarrhea?
100%. I love that you say this 'cause I've a few episodes ago that I recorded. Can't remember if I've released it yet or not. Um, but it was with a therapist, and she talks about like, especially for first time moms, and then obviously, like we said, in the beginning, no pregnancy or postpartum experience is the same for your recurrent experiences. How like beneficial it is to even have a session prior to delivering your baby,
Mhm.
of somebody that can sit down and be like, this is potentially what you could expect. And same thing, like what you said, those questions and like reflecting back. But so we can be semi prepared of what could come up, what to look for, especially in like the postpartum anxiety, depression, blues, psychosis, all of that. Right. And then hopefully with this space and stuff too, I'm not saying you have to go to a therapist, but just preparing these moms for what could come. Otherwise, it's like a punch in the gut. It's
Yeah.
like, holy shit. Not only do I have the progesterone hormonal drop, but
Yeah.
now I have maybe a colicky baby, maybe a reflux baby,
Yeah.
any of these things. And it all like preventative things. prevention is huge, which I already know you know. But really like setting these moms up for success.
Yeah. And again, I'm going to push back just a little. I just don't want it to be the moms. I want it to
Mm-hmm.
be the dads. I want to be the grandparents. I want
Yes.
it to be the village that we were promised.
Yeah.
And then you show up and like, where's the village? Because again, the onus always falls back on the mom.
Mm-hmm.
And it's like, well, yeah, but you are part of this. You are going to be part of this, regardless of where our relationship and our relationship status happens. We're going to be part of this if we're attached to this baby that we have created,
Mm-hmm.
and so I just like, if we're going to create this new era and this new things, is we're getting everyone involved in it. We're
Yeah.
getting the village involved
I
in
love that so much. Well, thank you for sharing so
it.
many valid points. And I'm such a science geek. I love and I need to know the why. Like, why
Yes.
is this happening? And you also share a ton of stuff on your Instagram. And if you do have any other socials, please tell me about them. But if anybody wants to follow you, where do they find you?
Yes, so definitely Instagram. It's Naya Care, Nayacare. I love TikTok. I will admit it. I'm a big TikTok.
Oh yeah, right.
And so you can find me on TikTok. It's Sonal Patel, fourth try doc. Then LinkedIn.
Mhm.
If anyone's listening in the audience, I do professional coaching for the professional women mindset. So we've had a couple of partnerships with businesses talking about the mindset of a parent and as a professional together. So
Ooh,
please
I
find me
love
on
that.
LinkedIn and Facebook. And yeah, I think that's about it. So
That's good. Well, I'm sure we will connect again in the future. I
yes.
obviously have so many more questions with so little time. Well, thank you so much for joining me here today. And I have no doubt that you're totally on the right path. Like you just light up when you talk about this, and I believe that every mom, family, dad, grandparent, baby deserves the care that you are committed to providing. I am
Oh,
so proud of you.
thank you so much. Thank
Of
you.
course.
Thank you very much. Oh, I will leave with that because that just blew my heart.
Oh, I'm so glad.
Thanks for listening to this week's episode. Please take a moment and on whatever app you're listening to us on, press that follow button to stay up to date with all future episodes. If you or someone you know are interested in being a guest on the Beyond the Birth Story podcast or a sponsor, please visit our Instagram or Facebook at Beyond the Birth Story podcast and send a message or fill out that contact form. I would love to connect with you. As always, remember to be gentle, kind, and hold space for yourself when you need it.